still talking about this exam, the NCLEX-RN exam. And this, for all of you who, if you're a nursing grad here in the US or anywhere in the world that you want to practice in the United States, this is the exam that you need to take. And this is the license you need to obtain to practice here in the US, to practice nursing in the United States. So the purpose of this exam is to basically to determine if you're a safe and effective nurse. Exam which has 265 questions, and you're given 6 hours to take it. All right, 360 minutes is the total minutes that you have for the 6 hours given to you. So minus the 5 minutes wherein the proctor is going to use to give you instructions and everything, minus another 10 minutes, because for every 2 hours you're given an option to take a break. 10 minutes break, take it. So every 2, so minus 2 10 minutes, so total minus 25, you are left with 335 minutes to answer 265 questions. So let's do a little strategy here. So in other words, you are only left with 1 minute and 26 seconds to answer each of the 265 questions, right? So, and again, you hear a lot of stories about the computer stopping at 75 and they pass. The computer stopping at after 60 minutes to 90 minutes and the computer stop and they fail. You know, because it is a CAT exam, a computer adaptive testing, meaning the computer is the one grading you, and if the computer determines that you are a safe and effective nurse, the computer stops. That's how I taught a lot of foreign, especially the foreign nurses they're struggling with their English and they pass using this timing, you know, how to beat the timing. But so the strategy is you answer 75 questions and give it 2 minutes per question, okay? Not 1 minute and 26 seconds. Make it 2 minutes per question on the first 75, okay? And use your critical thinking skills to answer this, and make sure you apply your knowledge of the Maslow's hierarchy of needs, because there's like within this there's already 15 to 20 questions that deals with this Maslow's hierarchy of needs. So you have to be, you're familiar with that because you're a graduate of nursing. Okay, just make sure you answer correct on the first 5. 3 or 5 questions has to be correct for you to have a cushion to go up, and I'm going to show you that later. And the remaining 190 questions of the 265, you just do it a minute or so. Okay, the strategy here is for the computer to stop at 75 questions. And you pass. So this is the strategy that I always teach. This is the timing in taking this NCLEX exam. So think about that, time it. So when you practice this NCLEX type questions, time yourself. The first 75, 2 minutes. Another thing that I wanted to show you is this.